Hi friends, I should have done this video earlier, but life got in the way. But I want to talk about cerebral palsy awareness. Many may not know that March is Cerebral Palsy Awareness Month. And cerebral palsy is a neurological disorder that is caused by different events that could include a prenatal stroke. It could be loss of oxygen at birth, or it could be injury, head injury, or infection. In my child's case, it was caused by a prenatal stroke that was actually diagnosed through an MRI when she was just a tiny infant. But the symptoms include, or can be very mild to severe, profound. In my child's case, she has a mild form of the disorder, but it still affects her every day. She lives with chronic pain, and her muscles get tight depending on the weather. Or and when she was growing up, it was also affected by growth spurts. So, but there's several types of CP. The most common is spastic, and that involves rigid or tight muscles. Dyskinetic CP involves uncontrollable, jerky movements. And there's ataxic CP, which the person who has it, it affects their balance and coordination. There's also mixed CP, which involves two or more forms of CP. It is a permanent disorder. There is no cure for it. As the person gets older, it is not a terminal disorder, but as they get older, it can become more prominent because of the overuse of certain body parts to compensate for the weak parts. And I should mention that CP can affect various parts of the body. It is not a one size fits all disorder. It can affect just the upper body or the lower body, or it can affect just one side or the entire body. It also can affect just the speech. So it does not mean that just because a person has cerebral palsy does not mean that they are lower intelligence or developmentally disabled. Many people who have CP go on to live relatively normal lives. They go to school, they get jobs, they get married, they have children. My child, her form is pretty mild, but as I said before, it does affect her every single day. But she is a college student, and she is training in the sport climbing. She's been entering competitions and doing very well with that. She is an extremely intelligent, talented child. She has been working hard. Um, so anyway, I just wanted to share, a little bit about cerebral palsy, because there is unfortunately a misconception that anybody who has a disability, they must be affected somehow intellectually, and that is not the case. Some people who have cerebral palsy are profoundly developmentally disabled, but that does not mean that their lives have no value. Every person alive has some value to them. But anyway, that is it for the cerebral palsy awareness. So if you meet somebody who, they have a different gait, meaning that they walk differently, or you notice that they have a limb that's more weak than the other side, or even smaller than the other side, um, you know, treat them like you would any other person. It has been my experience in the past that when people who don't know us, when they have learned, especially when my daughter was much younger, that when they would learn that she had cerebral palsy, a disability, many people, some of these people would assume that she was not capable of, living a relatively normal life. Now she will, have to be careful as she gets older, because she is at higher risk of arthritis. She's had several surgeries, and the pain. She lives with pain every day, and her muscles are affected by changes in the weather. But just remember, when you meet somebody who has a neurological disorder like CP, say hi to them, talk to them. Don't treat them like they are a defect, because they are not. So anyway, thank you for listening.